COVID-19 is the name of a respiratory disease caused by a coronavirus. This novel coronavirus began in Wuhan, China in December of 2019 and has very quickly spread across the globe. The disease spreads through person-to-person contact when a person with the disease coughs or exhales respiratory droplets. The symptoms of COVID-19 include fever, cough, tiredness, and shortness of breath in more severe cases. The onset is usually 2 to 14 days, and the duration of symptoms is about 1 to 2 weeks for mild cases. COVID-19 for most people is a mild disease. However, senior citizens and people with chronic conditions are especially vulnerable, and we need to take extra steps to protect them. The best way you can protect yourself is by frequently washing your hands with soap and water for at least 20 seconds. Alternatively to soap and water, use an alcohol-based hand sanitizer. It's important that you remember that your hands become contaminated every single time you touch a surface that other people may have touched. If you have the ability to sanitize those surfaces, you should. And if you can't sanitize them, try to create a barrier when you touch them. So use a pen to push on an elevator button. Use a disposable tissue to touch a handrail or a doorknob. When your hands do become contaminated because you've touched a surface that other people may have touched, you have to re-wash them or use an alcohol-based hand sanitizer. Other ways that you can protect yourself are to avoid sick people by keeping at least 6 feet away if you know that they are sick. Avoid touching your face. This is a habit that many of us have, and it is hard to stop doing it. Call on the people around you to help bring your attention to it. And finally, if you can develop a non-touch alternative to a handshake or a hug greeting, that might also help curtail the spread of this disease. People without respiratory symptoms should not wear a mask. It will not help protect them from the virus. People who do have symptoms may benefit others by wearing a mask because it will contain their respiratory droplets. You should be concerned about COVID-19. It's not a time to panic. That serves no one very well. But you should have a plan, and every family should know exactly what they're going to do to be able to wash their hands throughout the day, and what their very next step is going to be if someone in their family develops symptoms or is exposed to somebody who is known to have the disease or has symptoms, and your family member has to be isolated. People who have travel scheduled need to think carefully about the risk this may pose for them and assess and make a good decision based on that individual risk. St. Charles County is working closely with the CDC, the Missouri Department of Health and Senior Services, other local health departments, and local partners to monitor those folks who have traveled to affected areas and to investigate potential cases. Additionally, since there is a case in the metropolitan area, we've activated our incident command system and are working out of our emergency operations center. We have not encountered an epidemic of this proportion in generations. It has already been very disruptive to our daily lives, our travel, our economy. It's important that people remain accountable for their behavior and how that can continue the spread of this disease. And it's important that we care for the most vulnerable among us. Some citizens are much more vulnerable to this disease. Please be kind to each other. New information is coming out every single day about COVID-19. For current information, citizens can visit the St. Charles County Department of Public Health website. We keep it updated, and we also have links to other reputable sources.